Hi everyone, welcome back to OraCore. If you're here, you're probably wondering what really happens during a dental cleaning. Maybe you have an appointment coming up, or maybe it's been a while since your last visit. By the end of this video, you will feel much more comfortable and confident before your next dental cleaning. Now let's talk about why our dental cleaning is important. Remember that our teeth collect plaque every day. If plaque is not removed, it hardens into tartar. But what is plaque? Plaque is a soft sticky film of bacteria that you can brush away, while tartar is a hard mineralized crust that once it's formed, brushing and flossing at home cannot remove it. Only a dentist and hygienist can, and that's why regular professional cleanings are so important. If you want a more in-depth explanation of how buildup is formed, check out the video link in the top right corner. I go through every step in detail. Let's talk about medical history. Remember that a medical history during a dental visit is also crucial because your systemic health directly dictates how fast plaque builds up, how aggressively your gums react to it, and how safely your dentist and hygienist can remove it. For example, hundreds of common prescriptions, including blood pressure medications, antidepressant drugs, and antihistamines, cause dry mouth. Remember that saliva naturally dilutes food debris and neutralizes bacterial acids, but loosening it accelerates rapid plaque and tartar formation. In addition, conditions like diabetes compromise your immune response, allowing plaque bacteria to trigger aggressive and fast-moving gum infections. Similarly, with pregnancy or any hormonal shifts that might cause the body to overreact to tiny amounts of plaque, resulting in hyperinflamed bleeding gums. Certain seizure and immunosuppressant medications trigger gingival hyperplasia, as you can see in the video, causing gum tissue to physically swell and grow over the teeth. This extra tissue creates deep pockets that trap food and plug where toothbrushes cannot reach. It is also important to mention that during a professional dental scaling, removing hardened tartar inevitably causes mild gum bleeding. Your dentist might know if you take blood thinners like warfarin, for example, to manage clot risk or prevent excessive, uncontrolled bleeding during your cleaning. That's why medical history is very important and crucial in dental visits. Now let's talk about the measuring part. Remember that measuring your gums is like checking the foundations of a house. It tells the dentist and hygienist if hidden bone holding your teeth in place is strong or if bacteria are destroying it. So what does measuring do? It actually finds hidden spaces. Remember, healthy gums fit tight around your teeth, like a turtleneck sweater. When plaque bacteria builds up, the gums swell and pull away from the tooth, creating a hidden pocket where more germs can hide. But Angela, what else is also important? Well, it will also check for bone damage. If plaque stays in those pockets, it eats away at your jawbone. Since you cannot see your bone, the dentist and hygienist uses a tiny ruler to measure the depth of the pocket in millimeters to see how much damage has been done. These measurements help us evaluate your overall gum health. Depending on what those specific measurements turn out to be, dentists and hygienists generally recommend one of the following treatment options I will explain in the next slide to clean your teeth and manage plaque buildup. In this picture, you can see the potential cleaning options, which are prophylaxis, also known as routine cleaning or regular cleaning. This is recommended if your measurements are mostly 1 to 3 millimeters. This preventative cleaning removes soft plaque and light tartar from above the gum line in a healthy mouth. The other one is called scaling and root planing, which is also known as deep cleaning. This is required if your measurements show deep pockets of 4 and 5 millimeters or more. The hygienist numb the area to scrape tartar from the deep under the gums and smooth the tooth roots. They might also suggest to apply medication to those pockets. The other cleaning is also known as periodontal maintenance. This is a specialized frequent cleaning scheduled every 3 to 4 months for patients who have already been treated for bone loss to keep deep pockets stable. If you're curious about what those numbers mean during a periodontal exam, I made a dedicated video explaining everything. Just click the video in the top right corner. Remember, before any dental cleaning, the dentist or hygienist will examine your mouth. Remember, they're checking for cavities, gum disease, broken teeth, existing dental work, and signs of oral cancer. Now let's talk about removing tartar. This is the part most people think about. Remember that tartar is mineralized and cemented firmly to your teeth. Trying to scrape it off at home can ruin your enamel and severely injure your gum tissue. That's why dentists and hygienists use special instruments to carefully remove it. You may hear some scraping sounds, but that's completely normal. But how is the process? Providers use an ultrasonic scaling, as you can see in the picture, which is a vibrating metal tip that emits high-frequency sound waves, and a stream of water to crack, shatter, and wash away large chunks of hard tartar crust. Providers also use hand scalers, which are fine hook metal instruments and curets to manually scrape away any remaining tiny pieces of tartar from tooth surfaces and from deep underneath the gum line. And again, why you cannot do this at home? Well, because those metal scraper kits bought online can damage your enamel, leaving permanent grooves that trap plaque faster. And also because it may cause gum infection. Those sharp tools can slice open delicate gum tissues or push bacteria deeper into the gum pockets, causing severe infections. So make sure you schedule a dental cleaning to get appropriate and professional dental cleaning. Now let's talk about the polishing part. What do they use? Well, providers polish your teeth using a soft rubber cup and a special polishing paste. This paste removes surface stains and leaves your teeth feeling smooth and clean. Why polishing is so essential? Well, remember that will prevent future buildup. Hard scraping leaves tiny microscopic scratches on your teeth, but polishing smooths these out, so new sticky plaque and bacteria have a harder time gripping onto the tooth surface. What else it will do? Well, it will also remove extrinsic stains caused by coffee, tea, red wine, and food that regular brushing cannot move. It will also leave a clean feel. It gives you that sleek, just clean texture that makes it much easier for you to guide your floss smoothly between your teeth at home. Now let's talk about flossing. Flossing is important during dental cleanings and also at home because a toothbrush can only reach the front and back of your teeth, leaving up to 35% of your tooth surfaces completely untouched. Flossing is the only way to physically disrupt the daily bacterial buildup hidden in those tight spaces. Why you must floss every day? Well, because it will cleanse the blind spots. What does that mean? Well, remember the floss slides between teeth to scrape away plaque and trap food where toothbrush bristles cannot fit. Remember also that bacteria hide between teeth and perform glycolysis, releasing acid, therefore creating interproximal cavities that are very difficult to fix. So flossing will reduce this process. Remember also that leaving plaque between your teeth allows it to harden into tartar under the gum line, triggering the inflammation and chronic bad breath. Now let's talk about the fluoride application. This application is usually one of the last steps during your dental cleaning. Well, depending on your needs, dentists and hygienists might recommend a fluoride treatment. The fluoride is applied at the end of a dental cleaning and is usually used to repair and harden enamel that has been weakened by bacterial acids. After a cleaning, your teeth are completely free of the plaque and tartar, making it the perfect time for your enamel to absorb minerals. But why fluoride is used after a cleaning? Well, for several reasons. It will remineralize enamel. The fluoride rushes into the tooth structure to replace lost calcium and phosphate, reversing the early stages of tooth decay. Another reason is that it will create a strong surface because it will actually blend with your enamel to create a new compound called fluorapatite, which resists future acid attacks much better than natural tooth enamel. Another reason is that will block acid production. What does that mean, blocking acid production? Well, the fluoride penetrates the cell walls of remaining mouth bacteria, directly disrupting their glycolysis process so they cannot produce lactic acid. Remember that lactic acid is one of the causes of cavities. And we also reduce tooth sensitivity. Yes, fluoride will actually reduce sensitivity by hardening the outer layer and sealing microscopic pores of your enamel. It helps stop hot, cold, or sweet food from irritating the deep nerves. If you want to learn everything about fluoride and why it's an important part of preventive dental clean and dental care, watch the full video link in the top right corner of your screen. Does it hurt? Most routine cleanings don't hurt. However, if you have sensitive teeth, inflamed gums, or a lot of tartar buildup, you might feel some discomfort. If anything hurts during your dental cleaning or during your appointment, always let your dental providers know. Choosing the right dental office is crucial for your oral care journey. Look for a professional who is not only qualified but also makes you feel comfortable. Online reviews, personal recommendations, and consultations can help you find a dentist and hygienist who aligns with your needs and expectations. Let's talk about what happened after your dental cleaning. Well, your teeth will feel smooth, your mouth and your breath will feel fresh, your gums may be slightly sensitive for a few hours if there was inflammation, and you can usually return to your normal activities right away. Now you know exactly what happens during a dental cleaning. If this video helped you feel more prepared for your next visit, don't forget to like this video and subscribe to OraCore for more easy to understand dental education. I will see you in the next video. Thank you.